to share with you the first part. One is I really appreciate being here because here's the message to start with. You guys can make the difference. So I'm a local therapist, but let me explain to you kind of my position about it. I can see a kid an hour a week, maybe 2 hours a week. But who's going to pick up on changes the most with kids? Who's going to pick up on mental health issues with kids first? I think it's the school staff. And if y'all agree with me, the teacher's job has changed nowadays. Anybody agree with that? Amen. Who remembers when the teacher's job was just to come in and teach? Those days are done, right? Who remembers special ed when we were kids? Anybody remember special ed when we were kids? All right, who's my age or older? Who's over 100? All right, anybody remember, where was special ed when we were kids?
Little closet.
Anybody grow up around here? I went to Cleveland Heights. Anybody from Heights? Anybody from Heights say yay? Okay, excellent. Belvoir Elementary? Yeah, see, that's cool. All right, so special ed, separate room, down in the boiler room, separate place for those kids. Anybody remember those days?
Yeah.
And one of the weird things about special ed, when I was a kid, you went into special ed and you never came out. Anybody remember those days? You know, and now there's a big switch out there going on, and the switch is inclusion, and I think one of the things that we want to talk about is the changes for staff and teachers that's presenting out there. How many people would agree that there's maybe that change in kids that we're seeing in terms of mental health issues, pressures on kids? Any pressures different with kids nowadays? Okay, what's it like in the Mentor District for academics? Is it pressure? Anybody remember academics when we were kids? Okay, who remembers being a kid? No, with me here. All right, who remembers kindergarten? All right, what'd you have to do to get out of kindergarten? When we were kids, what'd you have to do? Anybody remember this? Yes, tie your shoes. Anybody remember that? What else? Right, yeah, write your name. What is it? Colors. And you had to count to 100. Sort of, kind of, shapes. Okay, nowadays, what do you have to do to get out of kindergarten? I heard you have to start your dissertation in some of the districts locally now. So, for example, for kids with anxiety, you know, if there was anxiety started there, I think the pressures around earlier for kids that we're seeing and some of those struggles that they have. So, hopefully, can you take a second, think about these questions right here. I gave you a few of the kids that I'm seeing. Now, I see a lot of mentor kids. And I know a lot about the districts because I see those kids. But I thought I'd give you some questions that might be relevant to a few of the things that you see. As you're thinking about those, I have a question for you. How many of you have been to a lot of in-service trainings before? Who's been around for a while? Anybody been around for a while? Okay, anybody been to an in-service training where they present a bunch of theory and research? Anybody been to one of those? And then you're thinking, it's got to get better after the break. And it doesn't, and then it goes on all day. So here's my consideration. I consider myself an oxymoron, a practical psychologist. So what I'm going to do is give you some time here today with some interventions that you can use because, again, the theme is you guys can make the big difference in mental health in kids. Who's going to pick up stuff fast, quickest? You all. Who's going to see changes? Other things that come up, things like medications. Well, if there's a medication problem with a kid, sometimes the parents don't recognize it because you're the first people that see it because you see them with other kids. So our first thing today is that we're going to be practical, present information to you that'll make sense, something that you can do right out of the gate. Okay, so let me ask you a question. People that are willing to volunteer, rather than me doing a generic presentation, what's the biggest mental health challenges you see with kids in the Mentor District right now? Okay, what stress do you see? What's the stressors? I'll go for the left side here, stress. Is this the elementary staff? Where's the high school people? Wow. Pretty wild. There's a Mason-Dixon line right here. Hi, high school people. Sorry, I can't come over there because there's a good thing in the way. All right, what do you see for stress? What's the social stressors? Okay, how is social stressors different now for kids than we were kids? A lot more divorce impact, yep. What else y'all seeing? Economic, what's the pressure on that? Those that have, what's that? That other kids have. That